Alyssa Zweifel, I'm an assistant professor at South Dakota State University. I am also the Healthcare Simulation Center director. So we actually started this pilot, our research pilot for Innovate to Educate, in 2024. So that was pre-competency-based education for us. We were concept-based, so we were teaching across the curriculum, but really focused on concepts. And we wanted to pilot before we started our true competency-based education, and we started that in fall of 25. So we're 2 semesters into it now, so our original pilot study for Innovate to Educate was pre of our whole curriculum going to competency-based. And we were really trying to figure out, how do we get students that are in the skills lab for 6 to 8 hours a day? How do we get them excited? How do we keep them practicing? We would see them practice 1 or 2 hours, be really engaged, and then the rest of the day they're just like, what should I do? This is boring, and then they just kind of moped around. And then of course the last 2 weeks of the semester, they're like, we don't have enough time. We need to practice more. We're not ready for validations or the grade or whatever the scenario was. So we really took this pilot and said, how can we innovate and be ready for competency-based education? And that's where we found, sim capture for skills, that peer-to-peer feedback, and just giving them the ability to know the expectations, but have the freedom to move about with skills and with peer feedback and with intentional feedback from faculty, and move about at their own pace. So that's kind of how we started our pilot. And then of course now we're in our true competency-based curriculum. And we took things from the pilot that we learned. Is it perfect? No, nothing's perfect, but we innovated it enough that it works now for our skills lab. The other thing we ended up doing is it's only in first semester, our skills, where our previous semesters we had 2 semesters of lab. Now it's 1 semester lab, and then they go out into the clinical setting. You have to be ready and safe for clinical versus having a little bit more of a 2 semester timeline. So during our pilot, I think the biggest challenge was faculty buy-in. Students love the peer-to-peer feedback because they could have this not so high level of feedback, but faculty were really concerned about it because they got stuck in the, how do peers give feedback? They don't know the skills themselves. So we had to kind of step back and talk about, so peers, have a guide. You need to teach peers how to give constructive feedback. And then faculty are the ones that are the experts still. So it's not replacing the faculty feedback, it's in addition to. So really taking that peer-to-peer structure and making it tangible might be the best word for faculty to understand. It's just giving feedback constructively from a checklist, but then the faculty should still be walking around the lab, giving that true intentional feedback saying, you performed that incorrectly, this is a better way to do it. This is a safer practice. And catching those mistakes, because the peers aren't going to catch those mistakes. The faculty are. So it's using a tool that's a little bit uncomfortable for faculty to get used to, because we still see faculty wanting to watch the peer feedback and critiquing it if it's right or wrong. And it's really not that, it's just giving feedback to grow. And the faculty also give feedback to correct any unsafe practices. That deliberate practice piece, we saw a lot of students that would practice 1 session and then not go back to the skill the next week or the next month, and really driving that, you can't just one and done your skill. You have to build that repetition, build that confidence, and then when you're more experienced, that's when you'll start to retain those skills. So that was also challenging because students, thought that if they performed it well once, it wasn't important to go back and do. So that's where we really focused on that deliberate practice, repetitive practice. remember your learning theories, because what I've seen is there's faculty that are louder than others, that have opinions or previous experiences, or you'll have one or two students that have a negative experience related to, skills lab or practice. And you shouldn't base your teaching styles just from those really loud people or that one or two students. Like, go back to the theory. What's the framework? What do we know from years and years of theory research, right? And then taking that and building your course from that, because there's always that foundation that you need to keep, or your course will, just explode and move in the wrong direction. So I constantly am taking my team back to, what's our foundation, what's our goal? It's that deliberate practice, and then you can build in the technology, and then you can build in a little bit of freedom above that. Yeah, really just remembering your standards of best practice and simulation. They're not written for a certain structure, a certain environment. Just always go back to those and ensure that everybody understands them and they're doing them every time you're teaching, and then you'll have a really strong foundation.